Everyone, this is a study guide for the second exam. It's 50 questions, multiple choice, and it covers modules 5 through 8. As before, I'm not going to go into an exhaustive review or a survey of the past 4 modules, but it's just going to be touching on the more important points for the exam, just to clarify some things that I think maybe were not as clear as should be in the topics. Maybe the topics were not really part of the discussion, or just something that I think bears repeating and discussing, just to help you know some important points, but also to help you refine your area of study. The topics are fairly in order. We're going to start off with group therapy and then move on until we end with last week's topic of complementary and integrative medicine. So, important to remember the types of groups that we discussed: open and closed, and what those mean, homogeneous and heterogeneous. Self-help groups are, the telltale sign of a self-help group is that it is homogeneous. The phases of group development, the 3 are orientation, the working, and the termination phase. It is important to know, and this is actually just from the module, I just put it here to emphasize this if you wanted to look a little further into this, but just be very familiar with these groups, the names of the phases, and what happens in each one. Some advantages and disadvantages of group therapy. Some of those were discussed on the discussion board. A couple of things I want to emphasize are that the primary purpose of group therapy is to facilitate changes by the patient to address identified problems, and there are lots of ways that can happen within group therapy. One of the things that shows that there is some healthy mechanisms going on in the group, there is some interpersonal learning, so group members are sharing positive and positive in a way that, that a patient is, or group member is going to be able to use it, and it's going to benefit them. It may not always seem positive at first, but hopefully leadership can help turn something that could be conflictual into something that is very educational and helpful. Another good sign of a good group is a good leader, and even though there are different strategies for leading, the leader really has to be able to switch that up as the situation dictates. Roles of group members. You will also see examples of those on the exam. So just to be sure to review that. Responsibilities of group leadership. Again, this goes into a few things, but also just to remember that being able to switch gears a little bit is very important between these styles. Excuse me. So also remembering the therapeutic or curative factors from Yalom that operate in all groups, and being able to identify examples of these. So what does universality mean? What is altruism? And what would be an example of that? Be able to understand these concepts enough that you would be able to identify a situation or a scenario and what one of these factors was happening. So some of these things I'm not going to go through and read through everything, just for time and to be able to get this video uploaded. The less time that it takes, the less time it will take to upload. Also, I just wanted to plug in a couple of things here that may be more review for you than really was covered in depth in any of the 4 modules, but just some things to bring forward. That Maslow's need for love and belonging is a correlate of group therapy. So this is something that is active during group therapy. Review Piaget and his stages. Understanding those stages and what developmental tasks are at hand helps you to identify some interventions that you can use for either educating a parent or caregiver, or what you would expect an appropriate intervention to look like for behavioral change. Mary Ainsworth, also just to review the types of attachment. Her theory posited insecure versus secure. A couple of different types of insecure are the avoidant, ambivalent, and disorganized. So these are other ways to frame this. You may see in literature either insecure, avoidant, insecure, ambivalent, or anxious avoidant, anxious ambivalent. It's really just another way to say it, and that's why it's in parentheses. Ambivalent also may be seen as resistant, and then disorganized. Sometimes it's also called disoriented. And then there's secure. And so we really don't focus much on that because that is a healthy attachment. We see the disorganized very often in children who have been abused. This is actually a it came after, or sort of a combination of these two, the avoidant and the ambivalent. So the avoidant, you really see a lack of affect with the child, and the opposite with the ambivalent. But it is the disorganized that you will see this almost sort of chaotic mix of the two. So it's sort of like a catch-all. And the temperament in children, it's not only mediated by their environment, but there are some genetic predispositions to certain temperament as well. So a child or even an adult's temperament is not necessarily only influenced by their upbringing. This, I believe, is in the summary. This is just some other important points for behaviorism. Behaviorism came before the cognitive theories, and remember that there are some behavioral principles and techniques that are used in cognitive therapy, but just know which are which. Be very mindful of the operant conditioning, aversion therapy, and what those mean. So the history and development of CBT. There are several questions on CBT on the exam. So this is going to be important information. Just remember, and I think that there's an understanding of CBT that I think that you probably have at this point, and I think that you will be able to answer many of the questions just based on that understanding, not so much memorization of particular terms, although there will be some. But if you remember that there's that cognitive triad, that is the theory part, and that the CBT therapy focuses on the automatic negative thoughts, these cognitive distortions, and some examples are the catastrophizing the mind reading, the overgeneralizing, those things that we just automatically think that are negative that cause a lot of depression and anxiety. And that CBT is really a very active type of therapy. It is not a supportive therapy. Your therapist should be very active in questioning. They give homework. They really get patients to look at these ideas and beliefs and what that causes. So remember that CBT is active, directive, but yet collaborative with the patient. So we'll switch over to milieu therapy. And understanding that a patient would really benefit from this therapy because it peers as well as staff or leadership, depending on what kind of area you are in. If it's inpatient, is where you really see milieu therapy executed. It doesn't really work in outpatient for obvious reasons. And if you had someone brand new to a unit, you would use an empathetic, but yet you want to be very accurate in your information and really orient them to the place, the space, and what the milieu actually is. Just some additional information for different types of milieu therapy for different disorders. There is more in the module. I just sort of went over anxiety disorders, depressive disorders, and then bipolar and schizophrenia. So just to emphasize those. And then we are into looking at the complementary and alternative medicine. So integrative care places the client at the center of care, focuses on prevention and wellness, attends to clients' physical, mental, and spiritual. Really a very holistic approach. Not that we don't already do that. This takes it a little bit further. So, I mean, as nurses, we think with it we are holistic, but compared to many of these types of alternative medicines, we are pretty biologically based, although we are very cognizant of the mind and body, or I'm sorry, the mind and spirit. So just some examples and definitions of some of the other types of alternative medicine. Identifying challenges of the CAM research. One of the biggest issues with this is that we just don't have the research. It's very difficult to get people to do the research. It's not going to be a moneymaker. Or there isn't any money to fund the research. I guess I shouldn't say it wouldn't be a moneymaker because it is a pretty big business, but it is, as yet, at least for like herbal remedies, many supplements are unregulated, very, very difficult to know what really you're getting. So that is probably one of the biggest barriers to having this be something consistent that we can use. So just went through probably the most widely cited problems with the research. Also, what I thought was really brought out well on the discussion board was how to approach this says consumers. I like to say patients, but I just took from the module. So exploring the consumers, or in our case, the patients, their use of integrative care, and just to be open about it, because as we discussed a little bit on the board, that it can be a rather contentious topic, not for everyone, but for some, it is really all or nothing. You can only do one. You can only stand on one side of the fence. So you may, at the risk of alienating your patient, you want to be very open-minded about it and at least be able to elicit the information about what they are actually taking. Here's just a little bit of information if you are interested in getting some credentials in integrative care. This is a very important thing to do. If you are practicing as an NP, if you're a family NP, PMH NP, any of that, if you really want to pull this into your practice, it would probably behoove you to get some extra credentialing. Remember that you're only really to practice within the scope of your PMHNP or your FNP. So this just offers you, well, not only a little bit more education, but then it also offers you the credentials and really just the safety of having something that backs up your level of knowledge and expertise in this field. There can be bad outcomes with recommending or suggesting or even prescribing supplements or alternative medicine, whether it's because patients don't actually get the care that they need because they didn't get something that was very effective, or because that there is something that they use that really it works to do harm, active harm. And then also, just to wind it up here, the 4 domains of integrative care. So there are mind-body approaches, biologically based interventions, manipulative approaches, and energy therapies. And then there are examples of each listed under there. So that wraps it up. That's going to be pretty much what you're going to find on the exam. There will be some other things, but as I said, there will be some review and with those questions, but this is the bulk. So I also have there is the study guide that I posted in the handout format. So if you wanted to just go back through, you can use this PowerPoint, or you can go back through your information, whatever you use for studying, and kind of use that as a guide. So I hope this is helpful. I am sorry that I was hoping to get this up by Monday. This course has changed a lot, and so I'm sort of going through it with you. I'm sort of taking this, I feel like I'm taking this course as well. So it's taking me a little bit of time to get through each module, to get the, putting new study guides together, new exam questions that are up. So that, and the challenges of the technical world. You think you get it, and then next time it's a little different. So I hope this is helpful. If you have questions, please email or even post them. If you want to put them in that general question area, that's fine. I'll get to it and post answers there for everybody. All right, everybody. Good luck.